Now, you brought two examples, and I want to share them with our viewers. So can you talk about the first one and what type of procedure is involved here?
So this is a patient that has a breast augmentation with saline implants.
Saline implants.
Yeah, this is saline implants. You can see the size before and after. She may have benefit from a small lift, but she didn't want to lift. She just wanted to augment the breast tissue. So you see there's still a little bit what's called ptosis, a little bit droopy.
Yes.
But she got a very natural shape, and is very happy with her results.
Okay. And now we have another image as well. Can you tell us what we're looking at here?
This is a patient that have an augmentation with an anatomical implant, with gummy bear texture implant. So you see the teardrop shape on her breast.
Yes.
It's a beautiful shape. Patient is very happy. In this case, we use an inframammary incision below. So you can see that if you see you don't have the markers covering the areola, you will see no scars there because the scars are under the breast.
Under the breast. I know there's different ways to perform a breast augmentation, which we can go
the most
under
common
the
ones
breast.
are around the areola, under the breast, or through axilla, which through the axilla, the companies void the warranty of the implants. I'm sorry, to the umbilical area.
Okay.
So you have areola, under, and axilla.
Okay.
These are the most common. And there's people doing through the umbilical area for saline implants. That's the one that avoid the warranty.
Okay. Now, one of the things that in the last picture that we saw, that's a patient who went from a size...
From an A to a full B, small c.
Full B, small c. And before we go, that's something else I wanted to bring up is, and you made such a great point, is that you need to have realistic expectations. And a lot of that comes from your measurements as well. Someone might come in saying, I want a full C or a D.
It's measurements. It's also your skin quality.
Your skin quality, okay.
It's also where is your breast, because a 20-year-old girl and a 45-year female will have different laxity of the skin. So sometimes you cannot have only an augmentation, you might need also a lift.
Right.
So it depends what the skin looks like. People come and say, no, I want an augmentation. And then you see them and say, listen, you will not get a good result because if they do augmentation with your skin hanging,
you're just gonna have big hanging breasts.
Double bubble. The implant here and the skin hanging. So you have to do a lift of the breast tissue, and that will imply more scars because you have now to make some cuts to lift the tissue.
Right.
And it's the famous inverted T or the anchor that people don't like, but that's the only way you can lift the tissue.
Right.